Hey everybody, welcome back to the I Believe podcast. I'm joined today by the famous Dr. Carol Shields, world-renowned ocular oncologist. And Dr. Shields, I just want to thank you so much for being a part of our podcast last year. Your episode did phenomenally well. And I also just wanted to give you a moment to, give a moment to offer my condolences in the wake of losing your husband, Dr. Jerry Shields. Do you want to just take a minute and tell the community just what should he be most remembered for? I know he's got a great legacy.
Yes, so I've had some time to think about this because he was not in the greatest health over the past 3 years. And, I think he came into this field of ocular oncology with a background in retina and a background in ophthalmic pathology. And he knew that the field of ocular oncology back in the early 70s needed a lot of organization. So Jerry spent most of his time just organizing various tumors, and together we worked and we would review current treatments for various tumors, what works, what doesn't work. And we took a field that I believe was kind of the Wild West and made it into a very organized, cultured field of ocular oncology where specific diagnoses can have specific protocols, and we have good imaging protocols for various tumors. And I just think he brought us from being very disorganized into a very organized field. Now when you go to our meetings, it's amazing how advanced we are in genetics and new treatments and saving vision and saving lives.
Well, I think it's absolutely incredible the work that you two have done over the last few decades. I don't even think I know exactly how many decades because I'm kind of a baby myself as the patient who's newer to this, at least comparatively. Like I've been in this for 5 years, but I know patients all around the world know who the Shields are, and we know so much of the forward movement that we've seen in ocular melanoma has come because of your guys' research and the research done by all of the people you guys have on your team at Wills Eye. So thank you guys so much. And those of you guys listening today, just send up some good energy, your prayers, whatever it is that you use, and just send that to the Shields family in the wake of this loss. But we are so grateful to see you here, and we know that you are so passionate about what you do for OM. And I've heard from a few little bugs in my ear that you've actually been doing a lot of telehealth appointments for ocular melanoma. And I'm not gonna lie, I'm not too surprised because we all did COVID, right? We survived that area. So with that in mind, will you just give us an idea of why telehealth? Why is this becoming a little bit more of an advantage in your field as an ocular oncologist?
Sure. I can talk for hours on virtual telehealth. So it was actually before COVID that the main people in our office, sat down and had a meeting, and we said, we've got to be able to provide care for patients so that they don't have to drive downtown in Philadelphia with all the traffic and the trouble and pay for expensive parking. And we should be able to see them at various remote sites and provide their care just as well. And those that really need to come down, well, then we'll tell them, no, we must see you downtown. But I think maybe 80% of our patients we can see at virtual sites. So we've set up 3 sites. We have one northwest of Philadelphia, one directly east of Philadelphia, and one directly south of Philadelphia. And they're all approximately, say, 30 to 60 minutes away from Philadelphia. And these are sites where we bought office space and we set up. There was a setup cost. We had to buy the cameras, the ultrasound, the OCT, and have enough office space to provide care for patients. So there was a startup cost. And what we decided to do was we would buy the same cameras we have downtown Philly, which we think are the best cameras available. We bought them for each of those sites so that when we see a patient, it's seamless. We're looking through the same camera, the same eye to see the fundus. And then what we do is every Monday, Tuesday, Wednesday, we will see a group of patients at a remote site. For example, on Monday, we might see a group of patients directly east of Philadelphia in Cherry Hill, New Jersey. And these are mostly New Jersey people, but we do see some Virginia people who prefer to go there, get a quick, all their imaging done, and then we hop on via Zoom, review all their images in front of them, dictate the letter in front of them, and then discuss it with the patient. It's really a great way to save them from coming downtown, and we have free parking at these places, and it's a lot more chill to go to a satellite than it is to come and go up the elevator to the 14th floor here.
Yeah, and I love what you said. You said a satellite clinic, right? So if I'm understanding it, Will's Eye is kind of the mothership, so to speak.
Yeah.
And then you guys have 3 satellite locations that are just a little bit further out so that, and please correct me if I'm wrong, people still would need to travel to Philadelphia or to the Pennsylvania area to attend one of these clinics, correct? But this just saves them the downtown, or is there a way to, like, say, see someone out here in Arizona?
Right. So in order for us to see a patient in Arizona, we have to have an Arizona license. So in order for us to see a patient in Pennsylvania, we have to have a Pennsylvania medical license, and we do. And we have 2 offices in New Jersey, in Cherry Hill and one in Pennsville. And the one in Pennsville is right across the bridge from Wilmington. So we call that our Wilmington office. The Cherry Hill's our East office. So we do have a medical license in New Jersey and in Pennsylvania so that we can see patients in either the 2 states. The only way we can see patients from other states is if the doctor sends the information to us. Then we can do what's called a doctor-to-doctor consult. But for most other states, we have to see the patient in.
Okay, no, that makes total sense. I just wanted to make sure to clear that up for any of our people listening so that they just understand, this satellite clinic saves them the downtown, all of those expenses, like you said, but they still do need to be in the state of Pennsylvania in some way, or in the state of New Jersey, where you guys have a license to do this kind of appointment. And obviously and it sounds like an incredible imaging center where you guys have all of the latest, like the ability to diagnose someone, for example, with ocular melanoma just by having them get scanned, and then you talk to them after looking at all of the imaging.
So, it's more than the cost of just coming down and parking. Part of it is the cost of having a son or daughter take off time from work and bring their father or their mother down to see us. And the other is some people from long distances have to pay for hotels. So it's estimated that telehealth in general will save the patient about $2,000 a year. Now, some patients spend more, some spend less, but still it's strong patient benefit. But it's also a benefit to doctors too. With telehealth, we can see patients very efficiently. There's no movement into a room, movement out of a room. In general, the patients are, very happy that they're being seen at some place close to home. So it makes the discussion a little bit easier. The one thing that we have to provide, though, for the telehealth offices, and these are called hybrid offices, because true telehealth is where you measure, via a glucometer, the patient glucose at home. These are hybrid telehealth offices where you have to actually go to an office, but you get all your imaging done. So we provide a technician and we provide a photographer. The same photographer that comes and does our photos, at date first seen in our office. And so we don't miss those 2, the days we do telehealth, and they'll see on average 30, sometimes 35 patients that they'll get all organized in telehealth, and then every hour on the hour, we try to zoom in to the telehealth office in between our patients at Will's. We'll zoom in, and then we'll see 4 or 5 patients and get them on their way, and it saves them the whole day. We even have patients who do telehealth with us and they go to work. It's incredible.
Well, I'm just thinking back even to my experience of getting diagnosed, and it was like a full day in the office. I mean, it
Yes.
was a full day.
Yeah. So new patients we tend to see in our office because it's it's ideal when you see patients in the office because if you have to do special tests in the office, like gonioscopy, where we put a lens on the eye to look in some of the corners of the eye, we get the best view right in person. So we always try to do our new patients in the office. But I have to say, during COVID, I mean, we saw patients in every state because they took down that restriction that you had to see patients in states where you had a medical license. I remember seeing a man in Alaska. Yeah, we just did it by
That's
Zoom.
so crazy.
Saw him in Alaska. We talked to him about the cancer that he had. We told him what medication to get, and he never even made a trip to us. We did the whole thing
Wow.
over Zoom.
That's incredible.
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late stage development for primary choroidal melanoma and in early stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
Okay, so I have a question. You mentioned like obviously that you prefer to see new patients in the office. So in the scope of ocular melanoma, like I mean, I know this is kind of maybe dumbing a point. Like I know you know this, but just for our listeners, like you get diagnosed, a treatment plan is set forth, whatever that looks like for the patient. They have their treatment, but then almost every, well, not even almost, every ocular melanoma patient has follow-up care. Is that correct? Like there's some level of follow-up that happens.
That is absolutely correct. And we generally, immediately after we do the treatment, we see them every 4 months. But after 2 years, we go to once a year. Because if they're stable by 2 years, chances are they're going to always be stable.
Yeah. So this kind of hybrid satellite clinic, this allows you guys to be able to follow up with patients virtually or, in this hybrid setting instead of necessitating the get to Will's Eye, have the entire experience that is the Philadelphia Will's Eye experience, which I mean, everybody's got to do it at least once, right? If you're coming there.
Right. Right. So they'll go to our hybrid telehealth offices, and many times they just show up in flip flops, cut off pants. They get their imaging. We zoom in with them because most of the time the patients we see in these offices are very stable. Like they've had a melanoma, it's already been treated, or they have a nevus, it hasn't changed, or they have a conjunctival lesion that we already removed. So we can minimize their trips downtown. And trust me, I come to work every morning at 5 a.m. and traveling the Schuylkill to work, even at 5 a.m., there's lots of cars on the road. And, I can imagine when our patients come in, it's going to be even more congested and more of a challenge because if they're more elderly people, it just makes it so much more difficult.
Yeah, no, I absolutely believe that. And I think this is so monumentally life-changing for those patients to, I mean, I just know that that's something that patients, especially those who have to travel from rural, like out of the city areas, this makes for an entire loss of a workday for most people, and or for a caregiver, right? Because sometimes you're dilated and you're just not confident driving, whatever the reason. This sounds like it simplifies a lot of things.
Yeah. So one other thing I'm going to say is, this is so new in the field of ocular oncology that there's not been much written about it. There was the first report to come out on telehealth in ocular oncology. An assessment of patient satisfaction was actually written by our daughter Nellie, who is a second-year resident at Wills. And she did a summary on telehealth in ocular oncology that was published in the Canadian Journal of Ophthalmology 2 years ago. And basically, not everyone's satisfied with telehealth. So, we think it's more of the older patients who aren't that comfortable with Zoom and they really want to see the doctor in person. But we had about 90% patient satisfaction, and 86% of patients said they would recommend it to a friend to do telehealth rather than go downtown to see the doctor. So, I mean, I think the days of waiting long hours in a doctor's office for something that's not so serious, I think those days are going to be, over. I think patients who have not so serious things are going to be fast tracked into telehealth, and they're in and out of a remote office within an hour.
That's
It's
incredible.
yeah, and another study just came out in the Canadian Journal of Ophthalmology from Vancouver, where they wrote their experience with telehealth and patient satisfaction, and they actually did a psychologically approved uh, test where they asked 10 standardized questions to the patients to see if they really were satisfied with telehealth. And it came out very positive that patients were definitely satisfied. I know this from personal experience when, I had to take my husband Jerry for certain checkups. I always wished, wow, I wish we could do this at home, just
Yeah.
talk to the doctor from home. Well, I think that time has pretty much arrived.
No, I think that you're so right. And as a physician, I can only imagine that telehealth and having this kind of a setting where you have this, this hybrid opportunity for patients who don't need that, um, they don't necessarily need to be in office in order to get, equal care. Um,
Yes,
I can imagine as a physician, this allows you to have way more time in your office for those patients who do have to be there in person and who you do kind of
exactly.
have to handhold through like an ocular melanoma diagnosis or whatever it is. Like your team then of people is much more able to focus on them, right? And their experience there and just making sure that they're okay. As opposed, just because it's so much more efficient, like to see all these other patients.
Correct. So what we do is, um, on days when we see patients in the clinic, we always run telehealth because the telehealth patients don't need a lot of hand holding. They just need, check, you look good, everything's fine, don't worry about it. Whereas the patients we bring into the office might need a little more explanation. They might need, some of them still need injections and they need to be in the office. So when we have gaps in time in the office, that's when we'll go and do our telehealth. It
Yeah.
works.
No, I think
Yeah.
this is such an incredible way and such an innovative way to approach ocular, ocular melanoma care specifically for our community. But I'm sure, like I know Will's Eye doesn't just cover the realm of ocular melanoma, and so I
Right.
think this is, like you said, I think this is cutting edge. Like this is the future of medicine as we have it now, and why not use the 21st century technology that we have?
Correct. Yeah. I mean, I have to admit, COVID kind of plopped us into telehealth, but we were starting it already before COVID, just realizing that not all patients need to wait all day to see us. Not all patients need to drive into the city or pay for expensive parking or stay overnight so they can be first on the list. They can actually access this closer to home. So this our telehealth practice services uh, upstate New York, eastern Pennsylvania, New Jersey, Washington, D.C., Virginia, even West Virginia, Delaware, Maryland. They all use telehealth offices. And, you know, for the most part, it's a positive experience. Um, oh, and the last thing that we do at telehealth is, believe it or not, we have a QR code. So we give the patient the QR code at the end of their visit so that they can make their next appointment. So they don't even have to call in to make an appointment. Now, I have to admit, I got this idea from my little Muffy's, who's my pet dog. Muffy's vet does the same thing. She doesn't do a QR code, but she sends a reminder to check in and make the appointments. And we choose our own appointments. So via this QR code, patients will choose their appointment, and the QR code takes them either to the Western satellite, the Eastern satellite, or the Southern, the Wilmington satellite, and it allows them to make their appointments there on their own without ever having to
I mean,
call
I'm a
someone.
fan.
Yeah, or sit on the phone for, 20 minutes waiting for someone to pick up again.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
We're really trying to use, we're using iPad photographs, um, uploading to the internet, Zoom calling. In specific times, we do FaceTime calling, QR codes. This is all like cutting edge technology. It is a lot of fun to be a part of it.
Yeah, no, I think it's so incredible. And I just admire any and all of the physicians that we have in our community who try to utilize technology like this, because I do agree with you. I think it absolutely improves patient experience and patient care in so many cases. And,
Yeah.
and I have to say, I think that, even for maybe the demographic of people who aren't as confident with technology, right? If they see their entire doctor's staff showing them, look, it is possible. We're all doing it. We all learned how to do it. I feel like that as a patient, that just instills that extra layer in your physician team. But also, just shows them like, okay, if they can do it, maybe I can too. Or at minimum, they can really help me to be able to do this and to handle this well and, to adapt. Because I think that's really what we're having to do this day and age is we have to learn to adapt and use technology in the most innovative ways we can.
Right. And I think hanging around young people makes it a little bit easier too, because they show me a lot of little tricks on the
Yeah.
phone. We do all of our dictation to the phone, which goes into our electronic medical records, which
So great.
we then we print out a letter, but we always put that in our chart, but we uh, e-fax the letter to the doctor. I mean, this is like, it's kind of beyond belief what goes on. And if I ever get like on the weekends sometimes, or even in the evenings, I might get an email from one of our referring doctors who says, hey, we saw so and so. She had a little bit of swelling here. Can you check your chart and let me know if that's new or old? And so what I do is I go into our electronic chart or I go into our images and I can check it immediately and answer immediately. Back in the old days, I would have to talk to a secretary, pull the chart, have the chart put on my desk, and flip through the chart. Now it's like immediate. So it's exciting.
Yeah, I love it. I mean, I'm just thrilled to hear you talk about this and to hear just how excited you guys are as a team to have been able to bring this from, its idea, like its inception, all the way to, okay, now we've got this well-oiled machine that is really working in our favor. So just kind of out of curiosity, I know Will's Eye is absolutely one of the most popular eye cancer centers or eye health centers in the world. How many patients are you guys able to see through telehealth? Do you have like a rough idea?
Yeah.
Maybe every
So,
week?
every week we see patients via telehealth, and we are scheduling anytime we see a new patient in our office. The technicians and I, they'll say satellite and or they'll say Cherry Hill. That's one of our satellites, and I'll say yes. So we make the judgment the day we see the patient for
Hmm.
satellite or not. So I would say every Monday we see on average 20 patients. Every Tuesday on average maybe 10 to 20, and every Wednesday we see on average 30 patients by
Wow.
telehealth.
Okay,
Yeah,
so you guys are definitely seeing, upwards of 50 patients a week just in telehealth alone.
absolutely. And, we're going to various meetings this year. Um, some of our more junior doctors will be going to the International Society of Ocular Oncology in Brazil, and one of them's giving a talk on telehealth. I told her, I said, you need to tell the rest of the ocular
Yeah.
oncology community how we do it, how they can do it, what some of the costs will be to the doctor, what
Yeah.
some of the cost savings will be to the patient, and how beneficial it is.
No, that
Um,
was what I was going to ask too is, would you suggest this for other clinics around the world
oh,
to
absolutely.
just
And
implement this?
I'm going to Stanford in November to give several talks at a big meeting they host there, and it's called Innovate Ocular Oncology. And one of my talks is on how to do virtual telehealth. You know, just to explain to them, you're going to need dedicated technicians, you're going to need dedicated ophthalmic photographers, and you're going to need a kind of an electronic wizard in your office who's going to be able to troubleshoot every time the Zoom goes down, or troubleshoot when the internet signal is weak. And we're lucky we already have that. And we flipped into telehealth. It's probably been 5 years now that we've been doing telehealth, but now we are pretty much telehealth 4 or sometimes 5 days a week. We'll do it, once a month we go down to Wilmington, but that's going to build to the point that we'll be going down, we say go down, but we're just doing telehealth going down.
Yeah, no, I get what you mean.
One technician goes down and one photographer goes down.
Well, and I think as far as staffing goes, the ability for you guys to kind of have people who can then travel, like just briefly, like you said, 30, 40 minutes. Like it's not like they're going states away. Like they're just going kind of branching out.
And we've made all the telehealth so that it gets done by noon. So it's always morning, and that allows them to come back to Will's if they have anything extra to get done at Will's, just to get caught up on emails or whatever, or to, just talk to us about whatever they did during the day. So we don't want to overwhelm them with really heavy duty telehealth. And that works fine too. I think our busiest telehealth is actually in Cherry Hill or in Bluebell, east and west. We have a lot of patients who love going to the Bluebell office because it saves them even touching the Schuylkill Expressway. That's the big road that leads into Philadelphia, and that's always a dangerous road to ride on. So we will catch like a lot of the patients from Rochester, Syracuse, Albany, Scranton, Reading, Allentown, and they'll go to Bluebell, and it just saves them a whole hour driving in, parking, and then waiting in the office, and then the whole hour getting back to that office site.
Well, I think it's absolutely admirable how well you guys have implemented this and how and just how well you're able to show that it works, right? And I look forward to hearing more from ISOO and IOO, and just hearing how we, I really look forward to seeing how more offices could implement this. I think that it will be absolutely life-changing for so many patients around the world. And I just want to thank you for being so dedicated to using the innovative technology in your practice, as well as, proving that it works through research.
Yeah, if we were back on old-fashioned, paper charts with slides and whatever, it would have been nearly impossible to do telehealth. But now that we're, completely digital with all of our images, completely digital with our chart, and we even have something that we call a living grid. This is important. A living grid is a summary of a patient's course, so that we know what we saw at each visit, but we only get one line to put it in for each visit. And it's a quick summary on when they had their plaque, when they were diagnosed, when they developed macular edema, et cetera, et cetera. So it's really and we have that all digitized, and that's also kept so that we can access it at any satellite and in our office, and it's HIPAA protected. Everything's HIPAA protected. And that's something very important. When you do telehealth, you have to make sure that all that you're doing is approved for patient privacy.
Yeah, that's absolutely so important. And I imagine that's something that, some patients, that's maybe one of their questions of, well, if I have this hybrid visit, is my data going to be protected, right? We're talking across the internet. Is that going to be safe? So it sounds like you guys have some incredible safeguards in place to make sure that HIPAA is always protected across the internet, because the internet is big. It is vast.
It is. And, you want to protect yourself from hackers. You want to protect yourself from, leakage of information and very private information. So we take care to always, obey the HIPAA rules, and all of our imaging, when it's uploaded to a HIPAA protected software called continuums. So we have everything organized in that continuum.
No, that's absolutely so reassuring to hear, I'm sure. But I am wondering for some of our listeners, maybe if they're listening, they might be wondering, okay, like, is this going to be something my insurance will cover? What do you have to say to that question if you get that,
Yeah.
at all in the office?
Yeah, so thanks to COVID, insurance covers telehealth visits. So for us, if we do a standard visit, uh, insurance will pay a standard payment. The only thing we're not doing is we're not putting on the indirect to look at the patient's fundus. We get wide angle images of the fundus so we can see everything. Sometimes actually we see even better on the wide angle images. But we get all the other imaging is standardized imaging. Yeah, and insurance covers this. So not only does the patient save in personal costs, but parking costs, but their insurance still covers it.
Yeah, no, absolutely. That's obviously going to be a big factor for some people who, if they just have questions. So thank you for addressing that.
Yeah.
Well, it sounds like you guys have a really incredible system in place, and I look forward to hearing from, I mean, it would be so fun to hear from a panel of patients who've maybe been part of the telehealth. So if you're one of those people listening and you guys want to chat on our podcast,
Boy, that would
please
be
reach out.
great. You know,
Please reach out. I don't know, Dr. Shields, do you want them to reach out to us directly, or do you want them to reach out through your office?
yeah, either way, it would be fun to actually have a panel of patients talk about what they liked, what they didn't like, and suggestions for how to improve. Yeah, that would be fun.
No, I think that'd be amazing. Okay, well, I'm going to put that on my to-do list of, find those patients. I'm going to put some feelers out. And then my only other question for you to wrap up is just, where do you as an ocular oncologist want to see telehealth and these kind of satellite, this hybrid visit idea taken in the wider world of ocular oncology?
Yeah. So I think the biggest future benefit of telehealth will be early detection of diseases that we previously couldn't detect because it was too far for the patient to come, or too much trouble for the patient to come in to see us, or their son couldn't take off the day, or they didn't want to stay overnight. Now we go out to them and we set up a whole office filled with cameras and stuff, and we can monitor. For example, this week, I was doing my telehealth on Monday, and I saw one patient that had a freckle in the back of her eye, and it had shown growth. Now, had she not come to our telehealth office, had she gone to her regular ophthalmologist or to somebody else, it might not have been detected. So it allows us to still provide good care for patients who have potentially really serious problems. Even for our children, we see a lot of children with eye cancers, namely retinoblastoma, and it allows us for that to monitor them even into their teens, into their 20s. They can still go to telehealth offices and get in and out and still go to work same day. Seeing a doctor does not need to be a whole day lost to the office. It could be at just an hour of your time getting imaging, then you go to school or you go to work or you don't bother your son goes to work. And then what we do is we either Zoom with the patient or we will have one of our technicians call the patient afterwards and just go through everything that we discussed. Yeah.
So, I mean, it really sounds like seeing more doctors, right? More doctors, not just your guys' team utilizing this, will just be a larger benefit for everybody seeking eye cancer care all across the world.
Yes, so it hasn't caught on quite as much in the world of ophthalmology, only because you have to physically send a person to the office to take the vision. There are ways you can do vision on Zoom. I could hold up a vision card and I could tell you, get a tape measure and stand X number of feet back, and now you will read this card. But you can't expect everybody to do that. So that's why we actually send a technician to do visions, pressures, ultrasound, UBM, ultrasound biomicroscopy, and then we send a photographer to do Claris wide angle images, autofluorescence, and OCT. That way we get all the information we need, and everything is done, everything is done within 15, 20 minutes per patient. And, theoretically, if we could see the patients right then and there, we could have them discharged right away. Except for the few that show activity, what we do is we bring them into our office. So for the 98% that don't need anything, we tell them, see you later, you're doing great, don't worry. For the 2% that show evidence of some change, we have to bring them into the office.
So if they do end up having to come into the office, does that end up being a same day, or is it like, oh, we got to bring you in tomorrow?
No, it could be same day. And typically, most of these offices are pretty close to the point that it's a 30-minute drive, maybe in traffic, maybe a 1-hour drive, but we could see them same day and get things situated for them.
Oh, I think this is so good. And like you said, I know we could talk for hours of this, but I definitely want to be respectful of your time so you can get back to seeing patients, I'm sure. But thank you so much for your time today, Dr. Shields, and for just this incredible idea. And we just, again, want to offer our community condolences for the loss of Dr. Jerry Shields. But we are grateful for the legacy that you guys continue to carry on at Wills Eye, and for the amazing, absolutely amazing critical care that you guys give to ocular melanoma patients. So thank you.
Thank you. Thank you very much. And thanks for allowing me a little bit of time to speak about Jerry. He was an educator, not just to patients, but to doctors, to ophthalmology worldwide. He was an organizer. What you might not know, when he was younger, he actually was a butterfly collector. And
Wow.
he collected butterflies to the point that he had the second largest collection in the United States. And he named them all genus, species, put them on cardboard poster boards, pinned them up like they used to do. And he used to exhibit it at many different places. And when he finally went to college, he gave it to the college that he attended, Murray State in Kentucky.
Wow.
So he
That's
was an
absolutely
organizer going way back, and he came into the field of ocular oncology and organized it like
nobody's
it was
business.
nothing. Yeah,
that's amazing.
he really did a great job. Mentioned you didn't know how long we were together. We were together 41 years.
That's
so
amazing.
It was a great 41 years. We had so much fun. Every day was an adventure, and I'm kind of opening this new chapter, and I am working in his honor. I know he would want me to continue, and I hope our daughter joins us.
Yeah, I loved hearing you talk about her being in her residency. So I hope that she joins you as well. I think that it's a really incredible family legacy, no matter which direction it goes. But I really think that you guys have done a phenomenal job, and I just applaud your efforts.
Thank you. Thank you so much.
I just want to go ahead and just take a quick second to thank our sponsors. Those of you guys listening, this podcast is sponsored by Castle Biosciences, Immunocore, Delcath Systems, and Aura Biosciences. Without their generous sponsorships, we would not be able to make this kind of video content, audio content, and just continue helping you guys know what's out there and what's new in ocular melanoma. So thanks again to our sponsors, and thank you hugely to our listeners, and finally to our guest, Dr. Carol Shields. We'll see you guys next time.